Welcome back to Daytime. Believe it or not, 46.3 million Americans don't have health insurance. It may be a hot topic in politics, but what about your health? What should you do if you find yourself uninsured?
Dr. Srinivas Iyengar, Daytime's resident doctor, is here to tell us how a lack of insurance doesn't have to mean going without health care. Good to have you here.
Hey.
All right, lots of people have lost their jobs recently and in turn lost their health insurance. So what kind of resources are available to them?
I know, and this is such a hot button issue right now because there are a significant amount of Americans right now that are out of jobs. And the thing is that what can they do when they do have a health issue or health crisis? First and foremost, we need to make sure that people at home understand that emergencies definitely need to go to the emergency room, but the emergency room is not a replacement for your primary care doctor if you should lose your health insurance. The ER rooms around the country are already pretty taxed, so there's going to be alternatives between the emergency room and not seeing any medical care, and they include retail clinics, urgent care centers, and community health centers.
All right, and they'll take you whether you've got insurance or not.
Exactly, and the retail clinics, let's start there first. Now, if you have sore throat, if you have a rash, if you have something of the sort where you'd like to be evaluated for potential strep throat, or even getting some vaccinations, these retail clinics and these major, shall we say, retail stores can offer these services sometimes from $80 to $100, so quite cheap, actually.
Now, what about blood work if somebody needs that? Would they go to a retail?
Well, see, that's interesting you say that because certain clinics will actually offer pregnancy tests, blood sugar, and they'll check your cholesterol potentially as well. Now, if you need to have something followed up, if you want to see, shall we say, get an x-ray or see a physician specifically for that reason, urgent care centers are the next step up. So basically what an urgent care center is are centers that are affiliated with hospitals but not necessarily attached to them. So if you have, shall we say, broken bones, something that needs stitches, if you need to have some of these other x-rays or, shall we say, testing done, urgent care centers are an excellent source if you obviously do not need to go to the emergency room. And if you do have a problem that's more severe, the physician most likely will send you to the emergency room after that.
If you're having chest pains or a headache that is beyond anything you've ever had, that's not an urgent care situation.
That is not an urgent care situation, exactly. If you're having any of those types of risk factors or, shall we say, symptoms, that is an emergency room situation.
Okay.
Now, you also mentioned the community health centers. What type of medical care do they provide?
Now, it's interesting to say that community health centers actually provide the spectrum of health care, whether it be dentistry, OB-GYN, and, shall we say, general medical care. Oftentimes, community health centers will service people who are basically uninsured and have either no income or low income, or basically have a pay scale, or they go on a sliding scale to pay for their health care. Now, the important thing here is that you need to find out the information about these health centers, because if you have a certain salary that's above what they usually treat, they may not be able to treat you. Now, another important point here, though, is what if you've seen your physician for years and you've just suddenly lost your job? My advice is talk to your physician. Talk to the office manager in the place where the physician works and see if they can schedule a payment plan for you on a reduced rate or a sliding scale of some sort, because at the end of the day, I like my patients. I want to see my patients in the office, and I don't want to lose them to the economy necessarily for that reason. It's the main reason is you need to make sure that you communicate this with your physician and potentially work out a payment plan so that you can be still seen by the same individual that you've seen in the past.
What about trying to go out there and just buy your health insurance on your own?
Well, and that's something that a number of individuals do. And if, depending on your age and your risk factors, if you're young and you've never had any major medical issues, potentially getting a plan with a low premium with potentially a very high deductible is an option. Obviously, that's a risk because, you know, you get into an accident, you're going to have a high deductible, but you want to be covered in case of a traumatic emergency. Likewise, though, if you're someone who does have health risks, potentially getting one with a premium of a higher, shall we say, level, so thus you are covered for your medications is another alternative. But this is all individualized, so you have to ask yourself and say, what are my risk factors? What do I need medical care for? And move forward from there.
And you really have to shop around.
Absolutely. And this is not a one-stop shop market. You need to see what's available and find the best plan that's individually suited for you.
If you have a primary care doctor that you really like, and then you say your wife or your insurance changes, how can you keep them?
Well, that's another thing that you'll have to basically discuss with the office you're in, because insurance plans changes with each medical office. Nobody takes a standardized version of just one insurance plan. So if your job changes, your insurance plan changes, it's something that you need to discuss on an individual basis with the office manager or the physician in the office.
All right, really good advice, Dr. Srinivas Iyengar. Good to have you here. Thanks.
More Daytime when we return.